Welcome back to the conversation. I'm Newbert. I told the conversation talk about different things that are going on in the Brockton area and the greater Brockton area. Last few weeks, we've had some politicians. We have a really important election coming up, so we want to basically educate the viewers and the listeners about what's going on. We want to bring on different candidates, and we're going to bring a candidate up for Congress. This time, we have Dr. Goldstein. First and foremost, thanks for coming on. Did I get your last name right?
You did, yeah. Thanks for having me on.
Absolutely. You're running for Congress, and I just want, for the people in Brockton and the greater Brockton area who don't know you, explain your background. You have obviously extensive background in healthcare, and why you decided to run for Congress.
Yeah, I took kind of a different path to Congress than I think most people do. I'm a physician. I'm an infectious disease doctor at Mass General Hospital. And I started my career in medicine knowing that what I wanted to do was care for communities of people. So way back when I started at Mass General, I decided to become a primary care doc. I decided that the community I was going to work with were those living with HIV, folks in the LGBTQ community, and people affected by substance use. I was really trying to work with people that had been left out of the system for a long time, people who are incredibly vulnerable in our system. And I've over 10 years built a practice that I'm incredibly proud of, but I've also recognized in that practice there are incredible challenges that my patients are facing every single day. And those challenges are so much larger than what a physician can deal with one-on-one in the exam room. And so in the 10 years, I've looked at ways that I can help people live a healthy life, help people get what they need to make sure that they're able to really achieve all of their goals. And I've done some work in the hospital. I've built the transgender health program at MGH. We started 5 years ago and built an incredible program that now provides care for folks all across New England to make sure they can be affirmed and welcomed and receive everything that they need. And that system change brought me to a place where I started to think about what else can I do? How else can I help folks? And over a lot of nights of conversation with my husband, a lot of conversations about what is the next step, we made the decision to run for Congress, and in particular, run for this seat here in the 8th District, recognizing that it's time that we have a healthcare professional in Washington helping to make decisions about healthcare access, certainly, but also someone who understands the social determinants of health, the way that housing and education and financial security and food security play out in someone's ability to live that healthy life that I've been talking about with my patients for so long.
It's funny when people think of politicians, for some reason it's a negative connotation, but a politician is just someone who helps people, and that's what you're doing on a full-time basis. So you help people just in a different facet.
Yeah,
I do want to get your opinion on in terms. So I was looking at your website and your commercial, and healthcare was obviously a big thing. Stephen Lynch originally voted against the healthcare bill. Just your thoughts on that and what needs to be reformed.
Yeah. So, way back when, 2010, the Affordable Care Act, the largest piece of legislation to expand healthcare since Medicare and Medicaid, and Stephen Lynch voted against that. He hasn't given us a great reason as to why he voted against that bill. But I saw that as a huge step forward, but not enough to address what I see as the three biggest issues in our broken healthcare system: access, cost, and equity. And for us to address those three issues, for us to make sure we have universal access, to make sure that we control costs, and to make sure that we provide truly equitable healthcare all across this country, we've got to make some significant reforms. And in my opinion, in my experience, having worked in the hospital, those reforms are moving us to a single-payer healthcare system. That's what I talk about on the campaign trail.
Explain what that is.
So that is, for people who have heard about it, it's Medicare for all. It is the idea that there is one insurance organization that's run out of the government that provides healthcare to everyone in this country. It means that we can guarantee access to everyone in this country. It means the federal government can control the cost of healthcare. And it means that we can address the racial disparities and the systemic racism that exists in our healthcare institution. We can only do that when we move to that system. And so that's why I'm such a huge proponent of the single payer or Medicare for all program that is out there in the federal government right now.
If you were to get elected to Congress, what would be some things that you'd attack other than healthcare that you think are pressing issues?
So I'll give you three. I think healthcare is obviously one of the big ones. The environment is another one. And I think we've got to make sure that we are talking about environmental justice and a package that is going to improve our environment and our climate policy with an eye towards the disparities that exist. We're here in Brockton, right? And this is part of Massachusetts that has some of the highest air pollution in the country and in the state. And that has a lot to do with the racism that exists in our environmental policy already, the racism that exists in our housing policy. And so if we're going to address the environment, we've got to make sure we're talking about those other issues. And then the third thing that I think is incredibly important is that we have to talk about transportation. Now, we don't talk a lot about transportation in the middle of COVID because people aren't commuting to work. But way back when I started this campaign, it was the number one thing that I talked about with folks on the campaign trail, because people recognize that to get from Brockton to Boston should not take an hour and a half, right? But it does because of our failed transportation system and our failed infrastructure. We've got to build a better system that makes sure that everyone can have access to all of the resources all around Massachusetts.
So let's talk about environmental justice. The big deal is the big piece of legislation that's being proposed is the Green New Deal.
Yep.
Alexander Cortez offered it, and I think on the Senate side, Bernie Sanders is in support of it as well. What are your thoughts on it? Is it something that needs to be tweaked? Are you in support of it?
Yeah, I'm definitely in support of it. I think the Green New Deal is a fantastic first start at our environmental policy. It is actually part of a much broader resolution. It's part of a resolution that says, if we're going to talk about environmental policy, let's also talk about transportation, let's talk about jobs, let's talk about racial justice, let's talk about healthcare. And that's why I like the Green New Deal, because it's this bigger package than just trying to solve the climate crisis. When I talk about the Green New Deal, though, I'm very clear to say that that's the first start, and then we've got a lot more to do. The Green New Deal is this amazing package that has us think about what energy sources we are dependent upon, right? Are we going to be dependent upon fossil fuels, which are going to make this crisis worse? Or are we going to transition to renewable energy, which is actually going to improve the crisis? It talks about efficiency so that we can be less dependent on energy overall. It talks a little bit about adaptation as well, this idea that there are some changes that are going to happen in our climate that we can't control. They're going to happen no matter what, and we've got to make sure we're ready to adapt to those changes. But I think we've got to put a little bit more energy and focus on those adaptation policies. Those are projects that we could start right now in the middle of this COVID crisis during an economic recession and get people back to work, get people the resources they need. Right? We could adapt so many homes to make them more energy efficient. We could adapt so many places along our shoreline to make sure they're protected from rising tides. We can adapt a lot of our infrastructure to make sure it can be ready for the rising temperatures. That's the work that we should be focused on right now to get people back to work out of this economic slump that we're in.
It almost seems like, when people seem to separate, healthcare, environmental justice, economy, but really, it's all really connected.
Yes.
Into one thing. And it sounds like you're saying that, we got to just think of it as one broader solution.
Yes.
They got to separate everything.
Absolutely, yeah. So, I like to think of this as there are these different circles, right? These overlapping circles of environmental policy, of racial justice, of our infrastructure, of healthcare. And where we're going to get the biggest bang for our buck, right, is where all of those overlap. And it's this concept called multi-solving, right? You get right to the middle, right to that core of where everything is overlapping. We invest in that space, and we can have a tremendous impact overall. That's where I think the federal government should be focused right now, because there are limited resources. We know that in the setting of COVID, and we've got to use those resources in the best possible way.
Do want to touch upon this. It's been the big issue the last couple of months, along with obviously the pandemic, is policing. Yes. Policing in America, with the unfortunate death of George Floyd and Breonna Taylor and so many others. Something that's personal to me, in terms of, number one, because I am a black man and also did some documentary work on this. In terms of on a federal level, what needs to happen for police reform? I know they're working towards they did a big criminal justice reform bill a couple of years ago, but in terms of policing, what needs to happen on a federal level, to improve the situation? Or do we even have a problem? Some people don't think there's a problem, and it's just a few bad apples. Yeah. I want to get your opinion on that.
Well, first, we have a problem. And I think the country is, as a whole, recognizing that right now. We're waking up so many people who weren't aware are waking up to the reality that there's a problem all across this country. There's a problem here in Massachusetts. We can't ignore that problem anymore. And I want to first say that I think some things that the federal government has done actually have been really fantastic and moved us in the right direction. And I'm going to call out the George Floyd Justice and Policing Act as a really great piece of legislation that begins to address the racism in policing, the brutality in policing, and I think we've got to build on that. Congresswoman Presley and Senator Warren have a great bill out to talk about qualified immunity. They have a bill out also to talk about making sure that people who need medical attention when they're being detained for whatever reason can receive that medical attention. Those two things, qualified immunity and the medical attention, seem like no-brainers to me, right? We should make sure that everyone's held accountable, and we should make sure that everyone has access to health care at the time of need. And when we do those things, we are going to actually make a tremendous impact in our policing policy. But I also want to just be very clear that we can't address the racism in policing until we see it in all the other sectors of our society. The policemen who are going forward with these practices, those policemen that are putting people at risk, putting black men, black women on the streets at risk, they were taught in our schools. They went through the public education system, and our schools need to address racism. Our schools need to institute an anti-racism curriculum so that we are really addressing this at the core, right? We also need to recognize that our healthcare institution is racist. We've got to address that. We have to recognize that our housing policies are racist and address that. When we begin to see it in every aspect of society, and when we begin to intentionally include an anti-racism piece to every policy that comes out of Washington, then we can actually address the racism that exists in policing as well. So we've done a lot of great things. There's a lot more that we can do, but there's this tremendous conversation that we have to have.
A lot of people are polarized in politics because they feel like people are unable to work together. Republicans and Democrats, they're so far to the left, so far to the right, and unable to create common ground. How, when if you get elected to Congress, how are you going to work with your Republican counterparts to, draft up legislation, do different things? Because you guys are going to have different perspectives, different areas of the country, different ideas, different beliefs. How are you going to be able to bridge those differences?
Yeah, I'll tell you two things. So the first thing is I'll say that I'm happy to have a conversation with anyone who believes in data, evidence, and facts. And so that person could be a Democrat, that person could be a Republican, that person could be an independent. As long as they believe in data and evidence, I'm happy to sit down and have a conversation. The second thing is that I'll maybe share a story with you of my work in the hospital and how I think that translates to politics. I mentioned that I established the transgender health program at MGH. MGH is a pretty conservative institution. When I started that process, I went to a lot of people who said, there's no way that this hospital is going to let you invest in a transgender health program, invest in this community. And I went door to door, and I knocked on every single door of the executives across the hospital, the chiefs of the different departments across the hospital, and I made my case. And I showed them why this is certainly the right thing to do. It is right for us to provide care to everyone in our community, but it's also the smart thing to do. It's economically the smart thing to do. And I was able to, with data and evidence and with perseverance, bring people over to my side and build a program that I'm proud of and that they're proud of. That type of work has to be done in Washington. We can't expect that if we put out a tweet in all caps, or if we go on cable news and yell at the other side, that they're going to ever listen to what we have to say and work with us. But I think we can expect, if we sit down and have real conversations, we show people data and evidence, we explain to them why this is right and why this is smart, that we can bring people along with the policies that we're all driving for.
So you don't think Stephen Lynch is doing that? Is that your main reason for running, or do you just think you can do a better job?
I think there's a lot of reasons why I got in this race against Stephen Lynch. We talked about the Affordable Care Act and his vote against that. He's also someone who describes himself as pro-life. He's had a history of being against the LGBTQ community. I've seen him in 20 years in his time in office not really take any leadership role when it comes to racial justice or police brutality or reforming our police system. I think we deserve a leader in Washington, and I think my values represent the values of the Democratic Party and the values of folks all across the 8th District. But I also think that we've seen that Stephen Lynch has actually sided with the with the Republicans for a lot of these issues. He's voted with President Trump 20% of the time over the past Congress. He is not someone who is, I think, bringing the issues that the folks of Brockton and the folks of the 8th District really care about to Washington, and he's certainly not fighting for those issues.
Remind the viewers, when's the election, and make a final pitch why they should vote for you.
Great. So the election's September 1st, although I'll say early voting in person starts on August 22nd, and many people are going to start to get their ballots as early as next week, the first week of August. So people can start voting for the entire month of August. If people want to learn more about me, they should check out my website, robbieforchange.com, ROBBIEFOR change.com. And I'll say the pitch is that I'm here to make sure that the voices of everyone across every community in the 8th District is heard in Washington, is lifted up in Washington, and is part of the conversation. I got into this race back in November, and I started with one phrase, which is that I'm in this race to fight for access, equity, and opportunity for every person in every community of the district. And I think if people agree with that idea, if people want to make sure that their voices are heard in Washington, I'm the candidate for them to choose on or before September 1st.
Well, listen, as a healthcare worker, I want to say thank you, because it's not an easy time to be a healthcare worker right now. You guys truly are heroes. You seem very genuine for what you're doing, so I wish you the best of luck. And reminding all the listeners out there and to the viewers, you got to come out and vote September 1st. If you don't vote, don't complain. Listen to the conversation. Thanks again for coming on.
Thank you for having me.